Good afternoon. On behalf of CDPH, I would like to welcome you to Talking with Parents about COVID-19 vaccines for children. This April 22nd, 2022, it is our pleasure to partner with hashtag This Is Our Shot, hashtag Vacunate Ya, and the American Academy of Pediatrics, California. Next slide. Our housekeeping reminder for panelists, please mute yourself when you are not speaking. And for attendees, please access today's slides through the following link on easyIZ.org/COVID/30conversations. We will also put that link into the chat for your convenience. If you'd like to open the deck and follow along, you're welcome to do so. And as always, we encourage you to share the slide deck with those that might benefit from its content and use. Please use the Q&A panel to ask your questions today. We'll be monitoring that panel, so look for that double bubble Q&A field. Drop your questions and comments in throughout our time together. And if you have any technical difficulties, please contact rachel.jacobs@cdph.ca.gov. Next slide. So a reminder, that's the icon. I just want to give you a heads up. If you don't see that on your screen, look toward the bottom. In the case on my screen, some of you, it might be in a different location, but if you're new to Zoom, sometimes people are, we just want to make sure you are aware of what icon you should be looking for to ask your questions. Next slide. Our objectives today are to provide the latest updates on pediatric COVID-19 vaccination, key messages addressing common concerns amongst parents about the COVID-19 vaccine, and communication tools for effective patient conversations. Next slide. So as we begin, we're going to bring a poll up. It's a quick poll, and it's asking, how confident are you in your ability to effectively speak with parents about COVID-19 vaccines? Thank you. I see those answers coming in. Boy, I would appreciate this. We want to get your response at the start. And then as we go through our webinar with Dr. Ball and have questions answered, we want to see if you feel more confident at the end. So thank you. Keep those answers coming in. How confident are you in your ability to effectively speak with parents about COVID-19 vaccines? Wonderful. Thank you. I still see your responses. Appreciate you taking the time to just click on an answer. Very confident, confident, somewhat confident, slightly confident, not confident. All right. We'll just go ahead and give that just another few seconds, and then we'll go ahead and close out that poll. Thank you. Thank you. You guys are wonderful. We appreciate that. We'll go ahead and move on to our next slide. And as we close out the poll and move on, we'll look at our agenda. And my name is Leslie Imani. It's my pleasure to moderate today's call and welcome you. I see so many of you joining and familiar names on the call and some new ones. So we're so glad and appreciative that you took time during lunch hour to spend with us with our featured presenter, Dr. Eric Ball, who will be talking with you about how to talk with parents about COVID-19 vaccines for children. We'll have some time for questions and answers. We'll have resources, another poll, and then we'll wrap it up. Next slide. So without further ado, it gives me great pleasure to introduce Dr. Eric Ball. He is part of hashtag This Is Our Shot, American Academy of Pediatrics, and the Children's Immunization Coalition. So Dr. Ball, please feel free to go ahead and begin your presentation.
Thanks so much, Leslie, and thanks to everybody who's joining us today. This is really important to talk about, especially at this point in the pandemic. Again, my name is Eric Ball. I am a primary care pediatrician with the CHOC Primary Care Network down here in Orange County, California. I'm also the vice chair of the American Academy of Pediatrics in California, and I'm active in a group called This Is Our Shot /Vacunate Ya, which is a grassroots organization which works to try to spread good information about COVID vaccines and other healthcare issues, primarily through social media and through training such as this one. Right now, we're at a kind of an inflection point in our dealing with the COVID pandemic. So most people who wanted to be vaccinated have been vaccinated already. When you look at this graph, and then we especially look at the older population, for example, the over 65, we're almost over 90% vaccinated. It's close to almost all of those people have been vaccinated, which is fantastic. And this has saved probably hundreds of thousands of lives over the past 6 months or so. The issue that I want to talk to you about, and the issue that's pressing to me as a pediatrician and a pediatric leader, is that we are lagging behind dramatically when it comes to vaccinating children. So if you look at our 12 to 17-year-olds, this age group has been it's been available for them to be vaccinated for almost a year now. So my 13-year-old daughter was vaccinated last May. So, and she was obviously the first day it was available. So almost a year, and still over 25% of 12 to 17-year-olds in California are not vaccinated yet. And then when you look at our younger group, that group has been, those vaccines have been available since November. So that's pushing 6 months now. We are at less than 40%. So 60% of our younger children are still susceptible to COVID-19 and have not been vaccinated yet. And what we're noticing recently is that we are having increasingly lower demands for that vaccine. In my practice down here in Orange County, we were previously giving these vaccines 4 days a week, and now we're down to 1 day a week because of lack of access, lack of demand. So in the beginning, I think all the people who wanted to be vaccinated were already vaccinated. And now people are just kind of straggling in. That's why this is an important day, an important conversation that we need to have, because the people who we need to vaccinate, the kids who we need to protect, are largely from families who have a lot of questions. And I want to talk to you today about how we can best speak to these families to give them good information and to speak in a non-confrontational way to convince them to give their children protection against COVID-19 where they otherwise might not want to. And if you look at the disconnect between the parents of these children versus the children, the odds are that most of the children have parents who are vaccinated. So a lot of parents will vaccinate themselves, but are reluctant to vaccinate their children. And a lot of that is because of misinformation or things that they've seen on social media or through peer groups, which are not true. And we'll talk about that a little bit. Next slide. The other issue we have here in California is that essentially the better off you are, so the more affluent you are, say, the more access to healthcare resources you have, the more likely you are to be vaccinated. And we see this with all vaccines, but we see this most dramatically in childhood COVID-19 vaccine. So if you look at quartile 4, which these are kids who come from the most healthy community conditions, these are based on zip code, over half of those kids are vaccinated against COVID-19. Whereas when you look at quartile 1, so those who come from the least healthy community conditions, less than a quarter of them are fully vaccinated. So now we have kids who have less access to healthcare, who probably have a lower socioeconomic condition, and they are much more likely to be vulnerable against COVID-19. And this is a disaster waiting to happen, right? These discrepancies, this inequity in COVID-19 vaccines will eventually lead to more disease, more death, more hospitalization among the people who can least afford for that to happen to them. So one of the goals for us is to have our healthcare workers go out there, try to get into these communities where the vaccine rates are low and get these children vaccinated to keep them healthy and protected against COVID-19. Next. So what are we seeing in California? So this is a disease that we see across all age groups. And as you know, obviously COVID is dramatically worse for older people, particularly over 65, but it certainly affects children a lot. I've hospitalized quite a lot of kids with COVID-19, had several kids in the ICU. And, as of last week, we had in California alone, almost 250,000 confirmed cases in kids 5 and under, almost 1.5 million in ages 5 to 17. And as we talked about before, there is a discrepancy and inequity. This is not an equal opportunity killer. The deaths and the hospitalizations tend to be higher in the Latino population in California and in those quartile 1 populations that you saw in the previous slide, partially because those are the least likely people to be vaccinated in California. So if we're going to be equitable, if we are going to do a good job of protecting our children in California and making sure they don't die or end up in the hospital from COVID-19 moving forward, vaccinating them is the most crucial role we have. Previously, we were masking in schools, masking on airplanes. We had that as a tool as well. But those mandates are gone, and I'm not sure if they'll ever come back. So we have to focus on a lot of these other ways to protect our kids, and vaccination is by far the best way to protect our kids against getting seriously ill from COVID-19. Next. So this is a graph. This is during the Omicron wave of deaths of unvaccinated versus vaccinated. This is for all comers, so this is for adults as well, but this is the effect of vaccines. So all of us know people who had been vaccinated who still got COVID-19, especially during Omicron. But what the vaccine did is it protects incredibly well against hardship, hospitalization, and death from COVID. So if you were vaccinated during the Omicron wave, you were in California, you were 5.5 times less likely. So if you were, if you're unvaccinated, you were 5 times more likely to get COVID-19. If you're unvaccinated, you were 12.5 times more likely to be hospitalized, and you were almost 9 times more likely to die from COVID-19. In all my time here, I have hospitalized only one child versus a few dozen, one child who was vaccinated versus a few dozen who were unvaccinated. And in California or in the country, the vast, vast, vast majority of the people who died during the Omicron wave and are still dying today, we still have hundreds of people a day in the United States dying of COVID-19, are people who are unvaccinated, either because they chose not to, or unfortunately in some cases because they're children who it's not available for yet because they're too young. But vaccines are incredibly effective against hospitalization and death and getting COVID. Next. So why am I talking to you? Why are we encouraging our healthcare providers to get out there and talk to families about COVID-19? It's because we as pediatricians are the most trusted source of information about COVID vaccines for our families. So we're more trusted than the mother and father's doctor. We're certainly more trusted than their health insurance, their employers, the CDC, the president, Anthony Fauci, everyone else. We have a relationship with these families. Many of these children I take care of, I have known their entire life. I've taken care of them for over 10 years, and we have a trusted relationship. We've gone through lots of things together, and parents trust our recommendations. They trust what we did with our own children. And so it's very important that as pediatricians, we come across with a strong recommendation and good reasons why their children should be vaccinated against COVID-19. Next. So let's start talking about how to talk to parents about COVID vaccines. This is unfortunately become a politicized issue, and it could be a charged conversation. And again, parents now who have unvaccinated kids, they've had almost a year to think about vaccinating their kids against COVID-19. So if you have a family now in your office that did not vaccinate yet, they probably have some deep-seated feelings about it that we need to kind of break through and talk to them about. So here are just some, quick little tidbits about language use. So we always say the word vaccination. We try really hard not to use the word injection or shot, especially around kids. Nothing freaks a kid out more than telling them they're going to get a shot. It's always important to talk about how these vaccines are safe and effective, and they are incredibly safe and incredibly effective. We talk about authorization of the FDA. As you know, these are all these vaccines are authorized by the FDA for adults over 18. For children, they're still an emergency use authorization, but they are authorized based on lots of testing and now almost a year experience in the field. I don't use words like emergency use authorization, Operation Warp Speed, things like that. I focus on families and I focus on individuals. So I think the people who wanted to keep their communities safe, they vaccinated for altruism, for the greater good. Those people are already vaccinated. I think you need to convince families now that they are going to get vaccinated to keep their kids safe, to keep their families safe, to keep their grandparents safe. Really focus on those like local at-home issues. I don't think focusing on the community or the country per se is very effective at this point in the pandemic. I try to keep government out of this. We talk about public health. We talk about doctors and health and medical experts. And then I try hard not to be derogatory against people who choose not to vaccinate. So I talk about people who have questions, or I don't talk about anti-vaxxers in front of families. I think that could be kind of derogatory, and it also stimulates some kind of harsh feelings in families. So everybody who vaccinates their kid or doesn't vaccinate their child does it because they want what's best for their children. And people who don't vaccinate their kid are not necessarily vaccine resistant or anti-vaxxers. They just are afraid of the vaccine. And it's my job to come to a common consensus with them and talk to them and listen to them and answer their questions and not ridicule them or call them anti-vaxxers. Next. So let's talk a little bit more about how to talk to families about this. So when we look at why families have concerns, why families choose to get vaccinated or not get vaccinated, we look at this hierarchy of needs. The number one concern by far for families about vaccines is safety. And this is not just for vaccines, this is for all medicines or surgeries or things like that. I think the effectiveness is a given. They know that these are going to work. They see it around them, but they're worried about safety. So when we focus on talking to families about vaccines, we talk about things that are safe and effective. So we focus on safety and effectiveness. So how will the vaccine affect me? Will I have side effects? What have you? Answer their questions about safety. We talk about efficacy. So is this working? You know, if I already had COVID, why do I need to get it again? So we answer those questions. When we get down to things about access or development, we have fewer questions about that, but I think it's always good to be prepared to answer those questions. People still have questions about how did this vaccine get made? Why is it, you know, how do we get it out so quickly and things like that. But most of the time, you're going to be talking about safety and effectiveness of the vaccines. Next. So this is our Shapa Kunataya. We talk about this 3-5-3 conversation methodology. And it's just ways to kind of break up your conversation with a family or a patient to talk to them about COVID vaccines. The 3 refers to 3 steps to starting the conversation, and we'll break those down. 5 talk about 5 key messages, which you want to make sure you get across in all of these conversations. And 3 stand for 3 post-conversation steps. Next. So let's talk about initiating the conversation. So the first thing I do when I want to talk to a family about COVID vaccines or anything for that matter is we ask and we listen to the answer. So when I go into a patient's room, I have their chart. I know whether they've gotten a vaccine or not. And if they haven't got a vaccine, the first thing I do is I ask them about it and I listen to their answer. And then I assess how far do I want to go with the rest of this conversation based on what they tell me. So I will say, hey, you know, it's good to see you. Johnny's here for his 10-year-old well child check. I see that he hasn't received the COVID vaccine yet. Do you have any questions about that? Can we talk about that? And then I'll wait for their answer. Sometimes their answer will be something that is very clear cut, that they do not want to talk about this more. I've had families say, I don't even want to talk about that. I'm not going to vaccinate my kid, or something where it's probably not going to happen. And I have a busy schedule. I have a lot of patients to see. It's not worth my time to sit there for 20 minutes and have a conversation with the family, which is probably pretty resistant at that point. So if I catch it that they are very resistant, I have like a 1 or 2 line statement that I will make, and then I will move on with the rest of the appointment. So what I usually tell them is, I totally understand you don't want to vaccinate now. Let me tell you really quickly why I chose to vaccinate my children about COVID. And the main reason I vaccinated my children about COVID is because COVID is not a benign disease. I've seen a lot of kids get very sick with COVID, and this is a very safe and effective vaccine. And people who are not vaccinated, unfortunately, are going to get COVID at some point. And when you weigh the risks and benefits of getting COVID versus getting the vaccine is far safer, far more effective than taking a risk by getting COVID, because the disease can be quite severe even in children. That's why I vaccinated my children, and that's why I myself am vaccinated. And then I move on. I don't talk about it much more unless they want to talk about it more after that. Now, more often, I'll get something when I ask about, you know, I see your kid isn't vaccinated, I'll get a statement such as, yeah, we haven't gotten around to it yet, or, you know, I'm not seeing a lot of kids with COVID right now, so I haven't really needed to get it, or, oh, my kid got Omicron back in January, so I think we're okay, right? So that opens the door for more conversation, and then we'll move on in our conversation. So after I kind of feel them out, the second thing we do is create an alignment of safety. So a lot of people have concerns, you know, and so I talk about, you know, it's my goal. We want to make sure that we do what's safest for your child, right? We want to keep them safe. We want to make sure they never get COVID. We want to make sure, I'm so sorry your child had COVID in the past. I know that was a miserable week for you. We want to make sure that that does not happen again. Let's talk about how that can happen. And then 3 is we need to find common goals. Remember that people who choose not to vaccinate their kids are not bad people or like dumb or uneducated. These are people who want what's best for their kids, and they think that not vaccinating is a safer alternative for them. And we as healthcare providers know that obviously vaccinating is the safest and best way for them to stay safe against COVID-19. So we find common goals like, I want your child to be safe as well. I want you to be able to take your kids to visit their grandparents and not put them at risk for getting sick. We want all of our kids to be at school safely. I used to say, we want, this is the best way we can get our kids to take our masks off at school, things like that. So you have to kind of feel around, but find what personally motivates them. For much of us, there is a reason to do something. I had a family yesterday who got vaccinated because their son is going on a class trip to Europe and they need to be vaccinated, right? They have a daughter who's not vaccinated. And so we had a conversation about the daughter. Like, I understand that the trip made you get vaccinated your son. Let's talk about your daughter. How was the process of vaccinating your son? Oh, it was fine. He did great. I feel good about it. Like, okay, let's talk about your daughter at this point. So figure out what their personal motivating reason is. Next. Let's talk about 5 key messages. So the first message, which you should always focus on, is that vaccine will keep you safe. So this is the best way to protect people from getting very sick against COVID-19. As we talked about, what is that, like 80% or 75% of Americans have been vaccinated against COVID-19 and are protected. This has saved hundreds of thousands of lives during this pandemic, and the vaccine is incredibly effective at keeping people out of the hospital, keeping people from dying against COVID-19, even for children. Next. I talk about side effects. Most families have lots of questions about side effects. Most of the questions they have are about things that aren't real side effects. They're about things that they've read. But I don't lie to parents. I'd say, this vaccine can cause symptoms. And most of our parents have been vaccinated. They just haven't vaccinated their children. So I talk about it with them. How did you feel when you got your vaccine? Oh yeah, that's really normal. My arm hurt. Also, I felt kind of crummy for a day. My son had a fever for a day after his. So it's definitely okay to be upfront about what to expect, because if they don't expect much in terms of side effects, if they have a fever the next day or feel crummy, they are going to have a negative outlook about the vaccine. So be open, be upfront about the side effects from the jump. Next. We talk about how the vaccines are really effective. Now, this has been changing a little bit over time, because when these vaccines first came out, remember, they were designed for the original COVID virus, and they were remarkably effective, over 90% effective in keeping people from getting COVID at all. So they were incredibly good at this. But over time, this has been a tricky virus and it has mutated. And now the vaccines are certainly less effective than they were before in keeping you from getting COVID, but they're still incredibly effective at keeping you from being hospitalized or from dying from COVID. And for those of us who are adults, those of us who are boosted, kind of reminding our immune system about this vaccine, it's even more effective. So, I'm always upfront with people. I tell them that, vaccinated individuals can get mild COVID infection. I can tell when I walk in a room and a kid has COVID, I can tell how many vaccines they've had just by looking at them. The kids who have had no vaccines, really sick. Even young kids, they look pretty bad. I had a baby yesterday who had COVID, looked pretty sick, pretty scary. Kids who've had 2 shots and have COVID generally have the sniffles or asymptomatic. So that's generally how this works. So the vaccines do a really good job of keeping you safe, and they're very effective at keeping you out of the hospital and keeping you from getting very sick. Next. I focus on the fact that this vaccine, although it is new, it is not based on new science. So this vaccine is the first of its type, the mRNA vaccine, the Pfizer and Moderna vaccines. But this has been based on over 20 years of research and science. They've been working on these vaccines for a really long time. And one of the reasons that these vaccines came out quickly was because they were already working on a vaccine for a related SARS coronavirus that hit Asia several years back. So we already had the scaffolding essentially for this vaccine before COVID hit. This vaccine was tested and it was studied the same as all other vaccines. And frankly, now it's the most common vaccine that's been ever, I think, probably ever given in the world. So over half of the world's population has received this vaccine. And we're almost 2 years into this now. So I had my first vaccination in December of 2020. So that was, 15 months ago. And then the people who are in the studies started about 2 years ago. So now we not only have a lot of people getting the vaccine, but we have a ton of time that shows that this vaccine is very safe. Next. The final key message, which I always end with, is ask me questions. What do you need to know, right? So I want parents to ask questions. I'm going to go through some very specific questions that a lot of families often have. And then I answer those questions to the best of my ability. I often refer people to myturn.ca.gov to look for vaccinations, or to other sites on the web, including the CDC, the American Academy of Pediatrics. There's a lot of really good websites that have good information. So I listen. These conversations can take a long time, but I listen and I answer the questions to the best of my ability. Next. So after you've answered all the questions, you've gone through this process, let's talk about post-conversation. So number one, and this is the most important thing here that I want to leave you with, is the outcome of this conversation does not have to be the child or the adult getting a shot today. So acknowledge their agency and their personal choice. If they choose not to get vaccinated today, it is okay. It is good that you had this conversation. And you can say to them, I really want you to get vaccinated today. It is the best and safest thing for your child. But ultimately, it's your choice, and I respect your decision. You do not want to be confrontational about this. I have had many, many families come back to me a day later, a week later, a month later, and say, hey, remember we had that conversation last month? I've been thinking about it, and I want to get my kid vaccinated today. So the payoff, the vaccine, might not happen right away. It might be a month or a week down the road, but it's important that you respect their decision. And then you keep the lines of communication open. So what I tell families is, I trust, it's okay, you don't want to get vaccinated today. If you have further questions, give me a call. I understand your husband who's not here today has a lot of questions for me. Here's my, here's the phone number to our office. You can reach me through the portal, through email. Let me know if he has questions. I'd be happy to speak to him as well. So keep the lines of communication open, and then offer to find vaccines for them. So I will explain to them the process of getting vaccinated in my office. I will help families find vaccines in the community if they need. At the very beginning of the pandemic, it was hard to find vaccines. I would help families make appointments at local pharmacies to get vaccinated. So navigating our healthcare system can be difficult. And even for us, in the healthcare, it can be difficult. I think using your knowledge of the healthcare system, helping them find vaccines, keeping the lines of communication open is really important. So I'll often close with, it's okay that you don't want to be vaccinated. Here's how you get in touch with me. I'd like to talk about this at any time. You said you wanted to go read about this. If you have questions after you do, please call me. We'll talk about it. And then you can always call our office. We're giving vaccines on this day, that day, and the other day, and you can schedule an appointment. So I leave it open for them, and then we kind of move on from that point. So that's our 3-5-3 way we like to speak to families or to patients about getting vaccinated. So 3 steps to start the conversation, get those 5 key messages in, and these open-ended 3 steps post-conversation. Next. So next we're going to shift and talk a little bit about just some common concerns about parents. When I left open that thing about having questions, these are some of the most common questions that we have. And these are some of the things that I talk about with families when I have those questions. So probably the most common thing I hear is COVID-19 doesn't affect children, or it's not bad for kids, or like it's just a cold, it's not a big deal. So just some data. I often don't throw data out at families, but for you guys, so in the US, over 12 million children so far have had COVID-19 that we know of. 120,000 children have been hospitalized with COVID, and 1,400 children have died from COVID. The thing we worry most about in kids is this thing called MIS-C, and I've had 3 children in the ICU with MIS-C over the past year. There have been 920 cases of this in California alone. MIS-C is this horrible inflammatory condition which basically affects all organs. It happens almost exclusively in children. It happens usually shortly after a COVID infection, and it's the leading reason why kids will die of COVID in the United States. It's horrible. Kids are in a lot of pain, and it's really bad. And the vaccine is incredibly effective. So there was a study which looked at kids who had MIS-C and whether they were vaccinated and unvaccinated. Almost all of them were unvaccinated. So it's estimated that vaccine is over 90% effective at preventing children from developing MIS-C. And that's largely because it prevents them from getting COVID, and it prevents them from getting bad COVID. And so it protects against MIS-C. MIS-C inflames your entire body. It inflames your heart, your brain, your lungs. And vaccination is the best way to prevent this. This is what scares us as pediatricians. This is what keeps us up at night about COVID. This is a big reason why my kids were first in line to get vaccinated. Next. We hear this all the time too, is that the COVID-19 vaccine is not effective. And again, we talked about this a little bit before, but it depends what your definition of effective is. So as we talked about, it is still very effective, orders of magnitude reduced risk from getting COVID at all if you're vaccinated, particularly if you're boosted or you're vaccinated pretty recently. But it's not perfect. Lots of people who got vaccinated still get COVID, but it is incredibly, incredibly protective against severe illness and hospitalization. And that goes for the Omicron variant. It goes for the new varieties of Omicron variants that are going around right now. This is the best way to keep your kid safe. It's the best way to keep your kid out of the hospital or to keep them from dying. People who are vaccinated often clear the virus earlier. So if you get sick, you get better quicker. So they spend less time sick, they spend less time in bed, they spend less time away from childcare and keep your parents away from work. So the best way to get kids back to life is to get them vaccinated. And then also vaccinated people are less likely to transmit the vaccine to others. So if you have a vaccinated child who gets COVID, they're a little bit less likely to be able to infect the rest of their family. So it's really important. So this is a bad virus that's killed a lot of people. One thing we're seeing now is we have patients, and there's a lot of kids, about to be over 140,000 kids in California alone who have lost caregivers due to COVID-19. So this affects kids not only directly, but also indirectly on the way it affects their families. And even if they get COVID and they're fine, you know, they're out of school for 10 days. The family's out of work for 10 days. It can be in the minimum a nuisance, and in the worst, you know, can lead to hospitalization or death. Next. A lot of people concerned about safety, a lot of like really bad information online about safety and things like that about the COVID-19. As we've discussed, over 200 million people and 20 million children in the United States have received the COVID-19 vaccine. We have enough people vaccinated where you would see in studies even very minor safety effects, and we have not seen that. And as I talk to parents about all the time, I truly believe that there's no situation where someone is not going to get COVID and not going to get vaccinated. I think every person on earth is going to be in one of three camps with this. Either you're going to get vaccinated and you'll never get COVID. So that's me so far. You'll get vaccinated and you'll get a mild breakthrough case, or you won't get vaccinated and you will get COVID. So when you look at those and you look at safety, and getting vaccinated is dramatically safer than rolling the dice with COVID. The effects of COVID are very variable. They can range from mild cold symptoms to death, even in children. And so when you look at safety, it's much better to be in that group that gets vaccinated versus to be in that group that kind of takes a chance with getting COVID. Next. So a lot of news about myocarditis. Myocarditis is inflammation of the heart, and the COVID-19 vaccine can cause it. So anything that inflames your body can inflame any part of your body, and it can inflame your heart. As I mentioned, MIS-C, one of the big killers with MIS-C is it causes severe myocarditis. It causes severe inflammation of the heart. So myocarditis has been seen primarily in older males, so generally like older teens to 20s, and much, much less likely in school-age kids. So the 5 to 11-year age group, we don't see it nearly enough. I've actually never seen a kid with myocarditis after the COVID vaccine because it's pretty rare. So for all ages, the risk of the vaccine, the risk of myocarditis in the vaccine is like 1 in 200,000. For this like highest risk group, for these like older teens, it's around 1 in 20,000, 1 in 30,000. We're talking about like getting struck by lightning numbers here. And so it's really, really, really rare. And when kids get it, it almost always goes away by itself. It doesn't require treatment. Their hearts are normal. They get better. So this is an extremely rare side effect. It's gotten a lot of press and a lot of media about it, but it's much, much more likely to get myocarditis if you get COVID. So the COVID virus causes inflammation in the body. It causes inflammation of your lungs and your heart and all these other things. And so the risk of myocarditis is higher from the disease versus the vaccine. So if parents are worried about myocarditis, the best thing they can do is get vaccinated, because that's the best way to protect themselves against myocarditis. Next. So people talk about how the vaccine was rushed. I don't hear this as much anymore now that we're, like a year and a half into our vaccinations, but 11.5 billion doses of the COVID-19 vaccines have been given worldwide. This is more than flu shots each year, lots of other stuff. So 65% of the world's population has been vaccinated. We've been giving it again for almost 2 years, and no safety concerns were seen in the childhood trials, especially in the younger group. Every step that we do in vaccine trials was done in this. It was just done very quickly. We cut out a lot of the bureaucracy. And if you remember, basically every scientist was working on this for a year. We put a ridiculous amount of money into this, and like landing on the moon, if we put our resources and our manpower and our brain power into doing these things, we can get these things done quickly and safely. So this went through all the same hoops that all the other vaccines did. It was just in a compressed time frame. And now we don't have that compressed time frame. We're like 2 years out, and we can see with the hindsight of time that this is an exceedingly safe vaccine. Next. So not as much as this as I used to get when the vaccine first came out. We used to hear this all the time, that people were worried about infertility. There's been a ridiculous amount of studies which have come out and shown that this is bunk, and there's zero evidence that the COVID vaccine affects fertility. This was based on some internet rumors and some lot of like social media posts that are kind of an old vaccine trope that a lot of anti-vaxxers would use to scare people about vaccines. We heard this about other vaccines, about the people brought up these fake things about infertility when we talked about the HPV vaccine as well. So it came back when COVID-19 vaccine came out, because nothing scares a parent more than like your kid's going to be sterile, right? So there's been a ton of studies over the past year about this who have shown obviously no differences in pregnancy success in people who are vaccinated versus people who haven't been vaccinated. As you saw, like in the age group of people having children, we're like at like 80% vaccinated. So if vaccine caused infertility, we would have no babies anymore because 80% of the moms are vaccinated. And obviously that's not true. And we've given the vaccine safely to over 200,000 pregnant women in California alone so far. So this is a very safe vaccine to give. And in fact, we now know that the vaccine should be given in pregnancy because it actually helps to protect the newborn baby to a pretty high degree. So we now recommend that all pregnant women receive a COVID-19 vaccine during their pregnancy to help the baby. So next. I've heard people say it's better to get immunity from the disease, right? So studies suggest immunity from vaccination is superior than immunity from a case of COVID-19. Immunity from getting the disease is quite variable. So some people get good immunity from it, some get bad immunity from it. I am seeing kids who are on their second or third course of COVID, and most of you guys probably know people who have had COVID multiple times, right? And that's because the immunity you get isn't very good from getting the disease. It's maybe like getting one shot of the vaccine, right? I've had like 4 shots of the vaccine. So my immunity is better than it is from those people. When you look at breakthrough disease during the Omicron wave, rates of breakthrough disease were significantly higher in those who had prior COVID versus those who were vaccinated. So we were seeing a ton of people who had had COVID back in the day who were getting it again during this wave, and they were getting just as sick as they were the first time. So their immunity wasn't super great. And there's actually a lot of evidence that if you already have had COVID, getting vaccinated on top of it like supercharges your immune system. And those people have amazing immunity. So getting vaccinated after you've had COVID is a really good idea. It's really safe, and it's the best way to keep you prevented from getting COVID again. Next. As parents, we always have worries about long-term effects of the vaccine, right? Like, is something crazy going to happen to my kid, 20 years from now, right? So there has never been a vaccine in the history of mankind ever made that had long-term effects. Like, people don't come to me and they're worried that the polio vaccine that their kid had when they were 4 months old is going to cause any long-term effects, because that's not how vaccine works. So almost every vaccine effect that we see is usually in the first day or two. Some will be a few weeks afterwards, but COVID, the vaccine side effects for all vaccines happen very soon after receiving the vaccine. Again, we've given this for a year and a half now, and we're not seeing any, long-term side effects. On the flip side, with COVID, we get lots of long-term side effects, right? We see a lot of people who have long haul COVID. I have several patients who have symptoms from their disease that's been lingering. They have long COVID symptoms. So long-term effects are a big worry with the disease. We also don't know how these long COVID people are going to do later on in life. Remember, there's a lot of viruses that have long-term effects. Think about chickenpox. You have chickenpox as a kid, and then you get shingles when you're like 70. And so we don't know what will happen with these people who got COVID, whether that will have longer term effects down the road. But if you're worried about, like myocarditis, if you're worried about long-term effects of anything, get vaccinated, right? The vaccine has no long-term effects. COVID, we know, has long-term effects and might have significant long-term effects down the road. So vaccine is definitely safer than the disease in this aspect as well. Next. And finally, just a brief word about vaccines and masking. So I feel bad for families who are in this situation now. As we talked about, there's over 60% of children, school-age children, are not yet vaccinated against COVID. No kids under 5 are vaccinated against COVID. And now we've gotten rid of our mask mandates. We were seeing very few cases of COVID, especially in schools, when kids were masked. And so it's a hard situation if you have a young child and they're in these situations. So if I had an unvaccinated kid, I would still want to wear masks in indoor close-knit situations. So masking is still a tool that we have. We don't need mandates to make us do things. We can do things because they're safe and they're the best thing to keep us safe. So masking is still part of our tools to keep our children and our families safe. So do it if you have kids who are at risk. It's definitely a smart thing to do. And then if you have high-risk family members, it's important to be vaccinated. My wife is immunocompromised, and so I flew this week and I wore a mask still because I didn't want to risk bringing home COVID, even though I'm vaccinated, to my wife. So I wanted that extra layer of protection. And now we're seeing issues with bullying and kids, having a hard time with masks. So I think it's important to talk to your kids about that, also about how we're doing this to, keep our families safe. I want to be able to not get my grandmother sick with COVID or what have you. So masking, although not mandated anymore, is not off the table, and it's still a tool that we can use even for the unvaccinated kids. And with that, I am going to turn this back over to Leslie.
Thank you so much, Dr. Ball. We're going to give him a chance to grab a sip of water. This is amazing information. And I want to just loop into the Q&A. You've asked some great questions. So audience, please feel free to continue asking. One thing that Luce brought forward is an increase in parents refusing the influenza vaccines during this past flu season. Some parents have expressed refusing flu vaccine because they believe it may be related or combined with COVID vaccines, or that somehow COVID vaccine was secretly added to the influenza. I think this adds her comment, something was secretly added to the influenza vaccine, such as COVID, by the government. Have you been experiencing, Dr. Ball, any similar situations when talking to parents?
Yeah, it's not just that. So I mean, that's kind of a hardcore conspiracy theorist kind of issue, which honestly I don't get that much, outside of Twitter. But there was a study which came out yesterday, which showed that the regular vaccination rate, so regular childhood vaccines, measles vaccines, polio vaccines, what have you, are at a huge low right now, and we find that people. I think vaccine hesitancy is kind of creeping from COVID vaccines into other vaccines also. And so we're seeing people who, frankly, their minds are being poisoned through social media and reading all these, terrible fake misinformation things, that they're now worrying about other vaccines, right? So, oh my God, if the COVID vaccine has microchips in it, then maybe the MMR vaccine does as well. So we are seeing greater amounts of vaccine refusal for a lot of these other vaccines, which is pretty scary. And what worries us as pediatricians is we're worried we're going to start seeing, now like measles outbreaks again, or whooping cough outbreaks and things like that, because our vaccine rates in general have decreased. Anecdotally, this was our lowest year for flu vaccines, and it's hard to say whether that's that like vaccine hesitancy creep, or because a lot of people weren't getting sick early on with the flu because we were wearing masks. We're seeing a lot of flu now, unfortunately. Or people are still kind of fearful of going to the doctor's office because they're worried they're going to get COVID here. But we're definitely seeing a decrease in all vaccinations, which is pretty scary. And I encourage you to use all of these techniques that we talked about with all vaccines, not just COVID vaccines.
Thank you. Ingrid had a question, and Ingrid, I did drop a link to your question, but Dr. Ball, if you could also just touch upon this to make sure we have this right. Ingrid wanted clarification. Are you saying that MIS-C, Ms. C, is caused by COVID and not the vaccine, or did you say it was caused by the vaccine?
No. It's caused by COVID. So the vast majority, over was a 91% of people who get MIS-C are unvaccinated, and it follows a COVID vaccine. Usually, I said that again, it follows a COVID infection. So usually within a month or so of getting a COVID infection, MIS-C will take over. I'll give you a quick example of a kid that I had, which was an incredibly scary story. Kid had COVID, 10 years old. It's a pretty mild case, had like cold symptoms essentially. I think they did a home test. I don't even think we saw the kid because the symptoms were pretty mild. Was fine, went back to school. Like 2-3 weeks later, the kid started having like fevers and like severe abdominal pain. And after having fevers for 5 days and vomiting and abdominal pain, they came to our office and we examined the kid. We actually thought the kid had appendicitis because his belly was so tender and because he'd had these fevers. And we sent him to the hospital. And he was admitted to the hospital for these fevers, and he continued to have high fevers, and he was really sick. And they decided that he must have appendicitis, and they did an appendectomy. So they took him to the operating room, took out his appendix. And when they were in the operating room, his appendix was totally normal. And they're like, I don't know what's going on, right? They closed him up, brought him back in. And then they did a heart ultrasound and found that the kid's heart was inflamed. And then they did some more tests, which were suggestive of like severe inflammation in the body. And that was MIS-C. He was in the ICU for several days with cardiac issues, with heart issues. And that was kind of a typical kid who has MIS-C, basically has COVID, a few weeks later totally decompensates. But the fact that he was so sick, they were convinced he had appendicitis was just crazy in this case. But he was a really sick kid. And the day the vaccine came out, he and his brother were vaccinated because the mom had such a traumatic experience with it. And he's obviously been healthy since, but super scary. I've had a few other kids in the ICU with MIS-C. So that happens again after a COVID infection, and the vaccine is incredibly protective against it.
Thank you for that. Arlene is asking, when is the best time to give COVID vaccine during pregnancy?
So not an OBGYN, but I believe they do it in the 3rd trimester because the reason we do COVID vaccines, we also do whooping cough vaccines for pregnant moms. And we do those to protect the baby. We do it for 2 reasons. One is because it protects the parents, right? So that they don't get sick. You don't want the family getting COVID when they have a 1-week-old at home, because that can expose the baby to illness. But more importantly, when you give the vaccine to the pregnant mother, she will make antibodies against COVID, against whooping cough, and the maternal blood and the baby's blood, they mix in the body through the placenta. So those antibodies will go into the baby's system. So when the baby is born with anti-COVID antibodies. It's born with anti-whooping cough antibodies. So that baby has some protection against COVID after they're born. And that usually lasts about 4 to 6 months. And that's one of the reasons why when you look at hospitalization rates for babies, they're a little bit lower than they are for like some older kids. And part of that is because if their parents are vaccinated, they get protected. And that's standard of care now, is to vaccinate the parents when they're pregnant.
Thank you. Dr. Ball, a little time for a role play based on Carlo's question. What are some tips for handling questions if I walked in and said that I was concerned about some very out there side effects based on what I've been reading on social media, and they're very random, such as growing things in certain areas, whatever it might be. Just I come in and I'm out of left field, per Carlo's quote here. How do you handle that? What are some tips?
Yeah, we get that. I mean, I've heard some crazy things, and you want to just like laugh or curse or something. And so we're number one, keep your cool. I'll tell you guys a quick story of something not to do because I screwed up. Is that I had a family and I was talking to the mom for like 15 minutes about COVID vaccine. They had a 15-year-old daughter, and she kept harping on the infertility thing. And I kept talking to her about it and giving her data and talking about how I vaccinated my own daughter. And at a certain point, I just got flustered and I said, like, she mentioned something else. I read this, that, or the other thing. And I'm like, that's BS. But I didn't say BS. I cursed in the office. And she wrote an email later that day to our practice administrator talking about how like offended she was that I was like cursing at her in the room. But you have to keep your cool. It's very hard to listen to this stuff because a lot of this is completely out of left field. And I apologize and I'm sorry that I lost my cool in that situation. So number one is kind of keep your cool. Understand that these people are scared. Like they've read like these incredibly scary things, and so find that alignment of safety with them and talk about, oh my God, I would be incredibly scared too if I read that. Let me tell you why that's not true, and here's why I vaccinated my kids or whatever. I try not to go down rabbit holes. Like if people start talking about microchips and things like that, you're not going to be able to like disprove that. You're not going to, I wouldn't start chasing that because you're not going to like what you find down that rabbit hole. So I try to keep it high level, talk about safety. I'm very personal about things. I talk about my own experiences vaccinating myself and my wife and my children. I find that helps. I always tell my families, I would never do anything for your kid that I wouldn't do for my own kid or for me. So I kind of stay on that level rather than go down these conspiracy rabbit holes.
Great. And a follow-up, I'm a child that comes into the office and says, Dr. Ball, I'm curious about learning more about the vaccine and maybe getting vaccinated, or tell me more about what that would be like. And my mom or dad is standing next to me and they are not responsive to that. How do you handle when a child is curious and the parents are not responsive?
Yeah, that happens actually. I've had several cases where there's a teenager, for example, who wants to be vaccinated, but their family does not want to be vaccinated. And I talk directly to the child, why, tell me why you made the decision that you wanted to be vaccinated, and they'll talk to me. And then I'll turn to the parents, like, tell me why you don't want them to be vaccinated. And I'll try to address those things as well. I am a big believer that teenagers, especially, need to be very involved in their own healthcare decisions and should play a major role. And they honestly, the parents need to be involved and the parents need to be part of the conversation. But like, I trust my 17-year-old to make good decisions for himself with my guidance. So I want to talk about that as a group and make sure that we all come to the same page. So I'm not going to vaccinate that child against their family's wishes. Like the parents have agency against that. So, but we're going to try to come to a consensus as a group and get to a common place.
Super. Arlene is asking, is it recommended to get a COVID vaccine booster in a teen if the patient had mild myocarditis with the second COVID vaccine in their primary series?
Yeah, I'm not positive. Again, I haven't had any kids who had myocarditis. I think it depends on how severe it is. I believe that the recommendations are still to recommend a booster afterwards, because again, the risk of myocarditis is dramatically higher with the disease versus the vaccine. But I would have to get back to you on the official recommendations to that. But I believe it's degrees of how bad it was. For example, if a kid was hospitalized, I think we do not do boosters for those kids, but we can get that information back to you.
Thank you. And as you already mentioned, while you're not an OBGYN, Jeanette followed up. Are you recommending, or would you know if an additional COVID vaccine dose would be recommended for women who have already been fully vaccinated prior to pregnancy? So now pregnant, already had their fully vaccinated, I should say, and now they're pregnant. Recommendations?
Yeah, they do it. They do it based on the regular schedule, right? So if they're due for a booster, say they'll get the booster. If they've already had 2 shots in their booster, then I do not think they'll give an additional dose at that point because they probably have a lot of circulating antibodies at that point. But if you think about it, pregnancy lasts 9 months. So if unless they got vaccinated, like when they were early on pregnant, it's probably been long enough time where they would be due for a booster. So usually the timing would work out with that anyway.
Great. On a personal note, Joanne said, my 27-year-old daughter was fully vaccinated early March last year and became pregnant with her first child in late March. She also received her booster dose 1 week prior to giving birth, March 8th, and her son was born very healthy and is doing great. She is nursing him, and you stated that immunity may last about 6 months. My question is, will his immunity last longer since she is nursing him?
Yeah, breastfeeding is great. I mean, breastfeeding is certainly not as good as getting vaccinated, and I hope that in the next month or two we will have vaccines available for this group, 6 months and up. But the reason why the immunity lasts for 4 to 6 months is all the maternal antibodies kind of fall away at about that point. And for those of you who are pediatricians who work in pediatricians' offices, we tend to see we don't see kids getting sick as often when they're little. So when they're about 6 months, that's when kids start getting more colds and ear infections and things like that. There's definitely evidence that breastfeeding, obviously babies get antibodies through the breast milk, so that could help to some degree, but I'm still pretty cautious about, taking that kid. Breast milk does not, it's not the panacea to keep that baby healthy. So the main thing is to, keep that child away from sick people and make sure that the family is vaccinated and all those usual precautions. But it's awesome that she's breastfeeding, and it certainly will help.
Thank you, and congratulations to Joanne and your family. Wonderful. And thank you, Dr. Ball. We're going to go ahead and move on. Based on our conversations today, as we move on to our next slide, we want to ask the same question we asked at the beginning. We're going to launch it right now. Following this training, how confident are you in your ability to effectively speak with parents about COVID-19 vaccines? Thank you. We see your questions, your answers popping up. We certainly appreciate you taking the time to just choose very confident, somewhat confident, slightly confident, and still not confident. And any answer is okay. We just want you to know that we're here to support you. So we still see answers coming in. Thank you. Looks like majority of you who answered the first time are coming back and answering. This is wonderful. Thank you. We're going to leave that open. We still see your responses popping up and into the post-webinar poll. So we're glad you're taking a moment just to give us those answers. And we'll go ahead and leave that open for another few seconds, but we'll move on to our next slide with some reminders and resources that there is a job aid on clinical talking points for providers of pediatric services. And this link is in the chat for you. It's a guide to have effective conversations with families about COVID-19 vaccines. Next slide. Toolkits, flyers, conversation guides, videos, hashtag This Is Our Shot toolkit from the 30 Conversations campaign and the interactive COVID-19 vaccine conversations module for healthcare professionals. Great resources, and all these orange links that you see on the slides are live links to take you to these job aids, including language do and don'ts. And some of you I know earlier asked for the slides. Yes, we wanted to make sure you're reminded that slide link is available in the chat. You can open it and find this and many other resources. And then the top 5 reasons your kids should get the COVID-19 vaccine. So we want to equip you with resources and conversation starters so you can, with confidence, have these conversations with your patients, the littles and the grown-ups as well. Next slide. Our next crucial COVID-19 conversations webinar will take place on Thursday, April 28th with Sharon Goldfarb, and this is talking with patients in rural communities about COVID-19 vaccines. Registration link is in the chat. Next slide. We also want to share that if you are a California COVID-19 vaccine program provider, we have every Monday, My Turn and My CA Vax office hours at 12 noon with demos, updates, and trainings. And every Friday, we have our provider office hours. Next Friday, April 29th at 9 a.m. We hope you join us. Next slide. Additional support is available through the COVID-19 Provider Call Center, My CA Vax Help Desk, My Turn Clinic Help Desk, and archived communications on the EZIZ webpage. We also have enrollment support for those VFC and other providers who are interested in joining the California COVID-19 vaccination program. Next slide. Special thanks to today's presenter, Dr. Eric Ball, and to our webinar planning and support team. Many thanks to all of you. We just want to share our appreciation with Dr. Ball. And Dr. Ball, any final words of wisdom to this audience that you would like to share?
No, just thank you everybody for joining. I know this has been an incredibly difficult 2 years, and thank you guys for all you do in healthcare and for helping children and the communities of California. I appreciate it.
Thank you, Dr. Ball. And we thank you for your commitment, as Dr. Ball said, to protect the health and well-being of our California's little ones and the larger grown-ups. It's a conversation that may be difficult, but again, we want to build your confidence in having the conversations as you are working to build COVID-19 vaccine confidence. We thank you for your time, your attention, and for your questions today, and we wish you all the best as you continue in your efforts to vaccinate California. And with that, we'll conclude today's session. Thank you all.